I am very sorry for the bad lighting in here. I'm downstairs in our downstairs kitchen filming this for you guys because baby is upstairs sleeping and I don't want to interrupt his sleep because he is so aware of everything, and even with his white noise machine on, I feel like he can still hear me. So we are downstairs in our little small kitchen with terrible yellow lighting. Yeah, but regardless, here we go. So welcome to this month's video. I'm very excited to be talking about this topic with you guys because this has really been a hot topic on my Instagram stories. If you guys don't follow Instagram, I highly recommend, because I'm on my stories a lot talking about all things related to fertility, IVF, healthy living. But I've been wanting to further dive into this topic of why are IVF pregnancies higher risk? Why are IVF pregnancies considered higher risk than spontaneous or non-IVF pregnancies? So I'm actually going to answer this question right off the bat because actually we just don't know. The more I researched into this topic the last couple weeks, the more I realized that scientists and doctors, they really just don't know the exact reasons as to why IVF pregnancies are considered a little bit more higher risk than non-IVF pregnancies. But I still want to discuss this topic with you guys in this video because I think the research that is coming out on this is very interesting and still very informative. So last year when Quinn was a newborn, I did a video very similar to this topic, but I just kind of went over the different things I had to go through in my IVF pregnancy, the different testing that's different from a non-IVF pregnancy. So if you're curious as to the different tests that normally you have to go through in an IVF pregnancy in terms of like extra ultrasounds you normally have to go to, and normally you have to be followed by a maternal fetal medicine doctor, I will link that video down below so you can kind of see maybe what you're in for if you are looking at an IVF pregnancy or you're newly pregnant with your pregnancy. And of course, before I dive into this video, I do want to welcome those of you who are brand new to my channel. I upload one video just once a month right now, and it's normally the last Sunday of every month, 8 a.m. on a Sunday morning Pacific Standard Time, all about IVF, fertility health. So welcome. Thank you so much for watching, and I hope this video is helpful. So over the past few weeks, I have been reading about high risk IVF pregnancies, the risk factors of an IVF pregnancy, why IVF pregnancies are considered a little bit higher risk than non-IVF pregnancies or spontaneous pregnancies. I've been watching YouTube videos, which by the way, there's not a whole lot of YouTube videos on this topic. I've been reading a few research articles, but overall, scientists and doctors are saying that we just don't know why there are a little bit more risk factors in an IVF pregnancy versus a non-IVF pregnancy, but they suspect many things. So let's dive into that. And by the way, as you guys know, I'm not an expert on this topic. I'm not a doctor. I just want to tell you guys some information that I've learned and maybe that'll help you. In this video, I'm going to go over the main risk factors of an IVF pregnancy. I'm going to focus on a few of the main ones, and then I'm going to close out the video by showing you guys a couple cute clips of Quinn, who's now my almost 1-year-old. Oh my gosh, his birthday is February 28th. I cannot believe it's been a year. It's just been such a journey, but a very beautiful one. In general, IVF pregnancies are considered higher risk than non-IVF pregnancies or spontaneous ones, but it also depends on the mom. So what I was reading about online is saying that having an IVF pregnancy doesn't automatically put you in the high risk category. It depends on your age, it depends on your health history, how many losses you've suffered, what kind of fertility issues you have, what kind of hormonal issues you have. So it really depends on the health of the mother first and foremost. So if you're younger, like below 35, and you don't have any health history, you don't have any fertility issues, maybe you're doing IVF for another reason, like maybe there's a disease in your family that you're trying to avoid, which happened to one of my friends, then having an IVF pregnancy doesn't automatically put you in the high risk category. The thing of it is though, most IVF pregnancies are older moms like myself, over the age of 35, advanced maternal age, and with a health history of like fertility issues like myself, hormonal imbalances, endometriosis. A lot of us have had to go through losses and different types of miscarriages. And so with all of that health history and age in mind, and then you add an IVF pregnancy on top of that, it does put you into a high risk category, but it is very individualized. So the main risk factors of having an IVF pregnancy that I was reading about are pregnancy-induced hypertension or preeclampsia, gestational diabetes, placenta issues, more specifically placenta previa, and then of course the need for early induction and the risk of C-section. And because of the risk of early induction, then of course preterm birth. And as you guys know, last year when I was pregnant with Quinn, I developed gestational hypertension and was hospitalized with preeclampsia at 36 weeks and had to get induced at 37 weeks and had Quinn. All went fine, but I fell into that high risk category of advanced maternal age. At the time I was 36, almost 37, developed preeclampsia, and so they were like, you know, in order to get you healthy and make sure baby is is healthy. Let's induce you at 37 weeks, which is considered term, and get baby out as soon as possible. And because that happened to me, I've been curious about this topic ever since. So those of you who follow on Instagram, especially those of you who follow on my story, you guys will remember this poll that I did. I asked you guys, those of you who have had IVF pregnancies, did you make it to 40 weeks, number one, and number two, if you didn't make it to 40 weeks, were you induced? Because I'm finding out that more often than not, you have to get induced with an IVF pregnancy and you don't make it to 40 weeks. And we'll get further into that later on in the video. Okay, so I'm gonna get into what I've learned about pregnancy-induced hypertension and preeclampsia in IVF pregnancies, then I'm gonna get into the risk factors of the placenta, and then I'll get into the risks of induction and not making it to 40 weeks. So I was very interested in this topic of gestational hypertension, preeclampsia, high blood pressure during pregnancy, because that's what I had. I've had a lot of people ask me, was I put on a baby aspirin? The answer was no, because I didn't have any health history of high blood pressure. I mean, I was still over 35, but not that much over 35. Just didn't seem like I needed a baby aspirin, and then lo and behold, I ended up developing preeclampsia. So if there is a next pregnancy for me, I will be put on a baby aspirin to hopefully prevent preeclampsia from happening again. So again, scientists really don't know why a lot of IVF pregnancies end up developing preeclampsia or pregnancy-induced hypertension, but there is a main theory out there that they highly suspect this is why a lot of IVF pregnancies do end up with high blood pressure. And it has to do with the absence of what's called the corpus luteum. A lot of you guys probably already know what that is, but for some reason, I kind of knew what the corpus luteum was before researching it, but I didn't really know. And I don't know why. This is basic anatomy and physiology. So I'm going to relay this information to you guys in case you guys don't know. So in a natural cycle, when a woman ovulates, the egg is released from the ovary. And when the egg is released from the ovary, there's a mass of cells that form that's called the corpus luteum. And that mass of cells called the corpus luteum is responsible for secreting progesterone and a lot of the pregnancy hormones needed to support a growing fetus. But the main hormone that it secretes is progesterone right away when the egg is released from the ovary. Now, if the egg is fertilized, the corpus luteum continues to secrete progesterone and pregnancy supporting hormones through the first trimester. And then by about week 12, the corpus luteum degenerates, and at that point, the placenta takes over for the corpus luteum's job, and the placenta is the one to secrete progesterone and the hormones needed for pregnancy. So when I found that out, it all clicked. I was like, that's why I needed to inject myself with so much progesterone, take estrogen pills, because I didn't have a corpus luteum. So if you don't ovulate, you're not going to have a corpus luteum. And so with most frozen embryo transfers, like myself, don't have a corpus luteum because you don't ovulate to get pregnant. That frozen embryo just is transferred in you. Now, a lot of frozen embryo transfers, if the woman can ovulate, they try to time the transfer with ovulation. And the reason for that is to try to get that corpus luteum going. And so if you can time your frozen embryo transfer with ovulation, then you're not going to need as much, or the theory is you're not going to need as much progesterone and hormones that you inject or take orally because you have a corpus luteum doing that for you. And that's the other reason why I could stop giving myself progesterone shots at week 12, because at that point I had a placenta who could take over that job for me. And I was like, oh, that's why. And I honestly should have known that already. I don't know why I didn't put the pieces together before this point, but I'm so glad I know all this now. So hopefully that helps you guys out who didn't know that. Another main hormone that the corpus luteum secretes is something called relaxin. And relaxin is responsible literally for relaxing the blood vessels of the female during pregnancy. And so because a lot of us with frozen embryo transfers don't have a corpus luteum, we don't have that relaxin hormone in our bodies, which then they're thinking, the theory is that can lead to gestational hypertension or preeclampsia down the road because we never had that relaxin hormone in our bodies. So I was like, oh, that is so interesting. I've gotten quite a few of you on the fence whether or not to take baby aspirin as recommended by your doctor in your first trimester to prevent preeclampsia. And I'm not a medical doctor, I'm not an expert, but I would take the baby aspirin if I were you, because if one tiny pill can prevent a life-threatening condition for you and your baby, then I'm all for it. And without getting into like a ton of like scientific details on baby aspirin, it's not to bore you guys, the thought behind taking baby aspirin to prevent preeclampsia is that the baby aspirin does help blood flow into the placenta, but it also can prevent inflammation and the platelet formation responsible for developing developing preeclampsia. So overall, taking a baby aspirin once a day, I think is like so worth preventing this horrible condition. Okay, so let's move on to why IVF pregnancies are at higher risk for developing placenta issues, placenta previa. So again, the answer is they really just don't know the exact mechanism that causes increased risk of placenta previa, placenta issues in IVF pregnancies. They have just seen a trend in using reproductive technology and then having placenta issues. Now, again, they don't really know if it's because a lot of IVF pregnancies are in older moms that are already higher risk for having placenta issues because of the advanced maternal age. A lot of placenta issues can happen when you have a health history of hormonal imbalances and other fertility issues before. So it's been very hard, it seems like, for them to try to decipher whether these risk factors are due to the IVF itself or whether it's the mom and her health history. Some scientists think that utilizing the ICSI method might cause some placenta issues down the line. Another theory is where the embryo is implanted into the uterus might cause the placenta to develop in a strange way. So there are a lot of theories on the table, but at this point we just don't know why a lot of IVF pregnancies end up developing placenta issues down the road, placenta previa. Again, seems like a lot of research is pointing towards the mom's health history, and her age. Okay, lastly, let's talk about early induction, preterm birth, induction, why a lot of us IVF moms don't make it to 40 weeks. As I mentioned earlier in the video, I did a poll on my Instagram story. This was like about a month ago now, asking you guys, number one, did you get induced? When did you get induced? Did you make it to 40 weeks? And then a lot of you told me the reasons why you got induced. So as I suspected, most of you who had an IVF pregnancy had to get induced, and most of you had to have your baby before 40 weeks. There were actually quite a few of you who did make it to 40 weeks, even though you had to get induced at 40 weeks. But there were also a few of you who went into labor naturally before 40 weeks. And I was like, oh, so it is possible to go into labor naturally with an IVF pregnancy. That's kind of what I was searching for, because I'm hoping to get pregnant again this year, of course, with another frozen embryo transfer. And I'm sort of like bracing myself for another induction. But in the back of my head, I'm like, is it even possible? I was questioning, like, is it even possible to go into labor naturally with an IVF pregnancy? And the answer is yes, because a few of you have. Another reason why a lot of IVF pregnancies have to get induced early, I mean early before 40 weeks, is a lot of IVF pregnancies, and me included, were followed by maternal fetal medicine doctors, and they are very cautious. They err on the very cautious side, very risk averse, because they realize that we have to go through a lot for our baby, very expensive, long journey of fertility treatments and infertility issues, that our babies are very, very precious. All babies are precious, but I think that they realize the journey for us IVF moms to get our baby has been excruciating and long one. So they err on the very cautious side just for those reasons. And so if they sense any sort of complication or any sort of problem coming on, they're gonna want baby out right away or as soon as possible, just to guarantee that baby and mom are healthy in the end. So in the maternal fetal medicine doctors' minds, and also a lot of us IVF moms' minds, that induction seems to be the safest route a lot of times, just to avoid any risk factors, avoid any other complications popping up. If there's any signs or clues that something might become a problem, then induction seems to be like the answer. And I'm not sure how much of this is true, but when I was researching like why not let IVF pregnancies go past 40 weeks, apparently there's a risk for stillborn. And I this is the first I've heard of that. I wasn't told that by my OB doctor, but some articles are saying that if you let an IVF pregnancy go past 40 weeks, the risk of stillborn goes up. So I don't know anything about that. I just thought I would mention that to you guys. Maybe comment down below if you've heard that or if somebody told you that. So bottom line, it seems like a lot of IVF pregnancies get induced just to avoid risks of that pregnancy going a little bit longer. And then of course, if complications arise, then the answer seems to be induction, just to get baby out, to guarantee a healthy baby, healthy mom. So in conclusion, IVF pregnancies overall are considered higher risk than spontaneous or non-IVF IVF pregnancies, but it also heavily depends on the mom, her health history, her age. So just because you're in an IVF pregnancy doesn't automatically put you in a high risk category. But if you are older, if you have comorbidities, you are going to be put at a higher risk. So why are IVF pregnancies considered higher risk than non-IVF pregnancies? The answer is we just don't know, and more research is needed to make further conclusions on why it seems like IVF pregnancies have more complications than non-IVF pregnancies. But it also seems like it has to do with most IVF pregnancies are in older moms with fertility issues, endometriosis issues, history of losses, and so all of that adds up to a higher risk pregnancy, higher risk for complications. So are these risk factors due to the reproductive technology itself, or is it from the mom's health and her age? So very interesting dichotomy, trying to decipher the two. Maybe it's a combination of both. So they're still trying to explore all of that. There are lots of studies out there already, but they just need more, and they need more data collection to further analyze all of it. Yeah, so there you have it. Please comment down below anything that I didn't mention, maybe anything that you've learned in your IVF pregnancies, maybe anything that you've learned from your fertility clinics, or things that you've heard that maybe I didn't mention, or maybe things you want to add that would be helpful to everybody. And of course, I'm still learning all of this, and I just think this topic is fascinating. I feel like I learn way more from you guys from these videos than maybe you learn from me. So the plan for us is our next frozen embryo transfer is still on track for August 1st. I am currently still weaning Quinn off breastfeeding. He doesn't breastfeed anymore, but I have been pumping. He stopped nursing at 10 months old because he wasn't interested anymore, but I kept pumping. I am now down to 2 pumps a day. This is a lot harder than I thought it was going to be. His birthday is February 28th. I'll insert some clips here, some current clips of him. I don't show him very much on YouTube anymore because I'm trying to protect his, his identity and his persona. If he wants to show himself on the internet later down the line, that'll be his choice. But since his birthday's coming up, I do want to kind of update you guys on what he looks like, how he's doing. He's in a full-blown crawling mode, not walking yet, but starting to furniture surf, and he's just literally our crawling mobile miracle. And yeah, I just can't believe he's a year. If you guys don't have Instagram, highly recommend you get Instagram and follow on stories, because I do put him on stories a lot since those only last 24 hours. But I'm just trying to be careful on how much I expose him to the internet at this point, since he's getting older and growing into what he's going to look like as a kid. Thank you so much for supporting me through my first year of postpartum. It has been such a journey, such a worth it journey, but such a journey. And especially with breastfeeding, because that has been the hardest part of postpartum for me. I can't believe I made it a year. My original goal was 3 months and then 6 months, and I just kind of kept going. So thank you so much for watching this video. Thank you so much for supporting this channel. Give this video a thumbs up if you liked it, because it does really help support my channel. I will see you in next month's video, and always remember to be kind to yourself.